Hello, I'm Dr. Brendan McKenzie and I'm the Skep Vet. Welcome to number 3 in my series of videos on diarrhea. In the first video we talked about when you should be concerned about diarrhea, and the bottom line was if your dog is sick, lethargic, not eating, vomiting, or if you have a dog who's older or maybe on some medical treatment or has a known disease. The second video I talked about what might happen if you go to the vet with your dog with diarrhea, what tests might they run, and the answer was probably not a lot. They'll do a good history, a good physical exam, maybe do a fecal test for parasites, and that's probably all you need if your dog only has diarrhea and no other health problems of concern. In this video I want to talk a little bit about what do we do about diarrhea. I already mentioned the bland diet. For most dogs, the good news is that acute diarrhea is going to go away by itself. You might have to wait a week, week and a half, but basically these dogs are going to get better no matter what. Their ecology in their gut is going to rebalance itself and go back to normal. Sometimes you can speed that process up a little bit with this bland diet, highly digestible, low to moderate fat. And sometimes fiber is a little helpful. It's a little bit unclear which cases are helped by fiber and which aren't, and what fiber source is best. For the most part, probably a little psyllium fiber is good. Canned pumpkin you can use, mostly water, not a lot of fiber in it, so it may not be all that helpful. In this case, I also want to talk about if you go to the vet, what are they going to offer you as a treatment for your diarrhea? And the answer is oftentimes not a lot, because in dogs who are otherwise healthy, it's not clear that adding medications or other treatments is really all that useful when most of them are going to get better anyway. Now, traditionally, we've often used antibiotics, particularly a drug called metronidazole or Flagyl, to treat acute diarrhea. We're beginning to change our thinking about that for a couple reasons. One, it's not clear that it actually works. There have been a few controlled studies that find no difference between metronidazole and either placebo or other therapies, or maybe a very small shortening of the time course. But we're talking about a half a day or maybe a day out of a 7 to 10 day course. So if your dog's gonna get better in 8 or 9 days and maybe they don't get better any faster or they get better half a day faster, is it really worth giving an antibiotic? And the answer is probably not. The other reason why we probably shouldn't be using antibiotics for routine diarrhea is they aren't without potential risk. Now, any medication that does anything at all has some potential side effects. These drugs are pretty safe and the side effects are minimal, but one of the things we know is that metronidazole causes what we call dysbiosis, that it upsets the ecology of the gut. And it turns out all the microbes in the gut are really important, not only for GI tract health, but for overall health. And if we're not sure that the medications we're using are actually helping the dog, we probably shouldn't be using them if they're also messing up that microbiome. Now, speaking of the microbiome, another treatment that's commonly used for diarrhea is probiotics. And there's some pretty good evidence that probiotics can be helpful with diarrhea, particularly certain kinds of diarrhea, like that caused by antibiotics. But the world of probiotics is really complicated. There are hundreds of different organisms that you can use, bifidobacterium, lactobacillus, lots and lots of things. And it's not 100% clear which organisms at what dose help which dogs with what kind of diarrhea. So it's a little bit of trial and error. And there are probably plenty of cases where we'll find out later that what we were doing wasn't the best choice. There are other choices that maybe would be better. So I think it's a good idea to try probiotics. I think we know at least that they don't cause the dysbiosis or disruption of the microbiome that the antibiotics do, but it's not always 100% clear how much difference they'll make. And again, good news is most of these dogs are going to get better anyway. Beyond that, there are 100 treatments out there for diarrhea, and I'll give you a little secret. Whenever there are 100 treatments available for anything, probably none of them work very well. Because if one of them or two of them worked really well, we would all just use those and get rid of all the others. So this is a case where we have lots and lots of products available and not much evidence for most of them. Some may work great, some may not help at all, some might actually make things worse, and we don't know because we don't have any good scientific studies on most of them. There are also some more advanced and newer therapies which are looking promising. One of these is what's called fecal microbiome transfer or transfaunation. This is where you take poop, basically, the microbiome of a healthy dog, and you put it into a dog with diarrhea, either as an oral capsule or sometimes as an enema. And there's some good evidence in humans for very, very limited conditions that this may be helpful, but right now it's pretty experimental. We don't actually know how to screen the dogs that we get the poop from to know that we're actually only getting good stuff and not bad stuff. We're not always sure which dogs will benefit. And honestly, if you have a dog that's otherwise healthy and it has diarrhea and it's going to be better in a week or a week and a half anyway, might not be a good idea to go around trying experimental therapies like that. So I think that may become more common in the future, but it's pretty aggressive for most dogs who are basically going to get better by themselves. I hope this has been helpful. As always, I have references and journal articles and lots of more detailed articles on the Skep Vet blog, and thank you for watching.